Welcome to our hip mobility workout that we're going to be focusing on hip internal, external rotation, in addition to pelvic mobility as well. So focusing on helping to shift the pelvic position, to release tension in the pelvic floor, to release tension in our thoracic spine, to improve how we can move our hips, and also to help relax our pelvic floor. So this workout you can do both during pregnancy and the postpartum period. You may have to make some slight modifications based on how pregnant you are and if belly's getting in the way, but we'll talk about some of those modifications as we move through this workout. So for this workout, you'll just need a yoga block and a place to do your movement. We're going to move through 3 exercises. The first is going to be an adductor to pigeon. So we're going to start with the right leg extended out. The left leg is going to be behind you. You're going to shift the hips back. You're going to lower down to that elbow to have a little bit of rotation towards the left side. And then when you come up, you're going to bring that right leg behind you to sit back into a pigeon. And so this is where if you're super pregnant, you may not be able to go down very far. So just be mindful of that. The next movement is going to be a 90-90 side camel. So you'll start in this 90-90 position with left leg in front, right leg behind, and then we'll alternate sides. You'll start by leaning towards the internally rotated side for that side body opener. So this is going to be that lateral thoracic mobility. Reach that hand behind to extend in the hip to have more of that hip flexor stretch here. And then we'll alternate between the two for this really great hip mobility movement that's also helping with thoracic mobility. The final movement is going to be an all-fours hip shift. So you're going to bring the knee onto an elevated surface. Shift the weight over towards that elevated hip to feel this stretch in the glute. And then we're going to do some pelvic tilts here from front to back. We're going to move through one round of all of these movements, but feel free to do this workout multiple times to really help to release in the hips. But before we dive into today's workout, I do want to share that my book Training for Two is now available for pre-order on Amazon. You can grab it now. It's being released September 14th of 2024, depending on when you're watching this. This book is going to help you to know how to approach training throughout your pregnancy. So how we can use prenatal fitness to have a strong pregnancy, a pain-free pregnancy, while also helping to prepare us for birth. So prenatal fitness is more than just omitting sit-ups and crunches and jumping. We want to make sure that the movements that we are doing are mindful for our birth preparation to release tension in our pelvic floor and to create more space within our pelvis. So check out my book in the notes below. You can pre-order it now, but it is coming out this September on the 14th, hopefully after my baby is born. So let's go ahead and get started with today's workout. We're going to start with that adductor to pigeon movement. So starting with that adductor movement, we're going to extend the leg out. I'm going to do my right side out. So my right adductor is going to be stretching. Hands are in front of me. You can either tuck that left toe or you can keep the toe flat on the floor. When we start, I'm going to focus on shifting my weight back and dropping down to rotate. So shift my weight back to feel that stretch in the inner thigh, drop down to the right forearm to have more of the thoracic rotation. Come up, and then I'm going to swing that right leg behind me to find that pigeon stretch. Come out, back, coming into that adductor rock back, come forward, and then shift into that pigeon. And so we're just alternating between the two. So we have an inner thigh stretching exercise followed by a glute stretching movement. For me, my right inner thigh is a lot tighter than my left side, but my left glute is a lot tighter than my right. So this movement is really nice because it's kind of targeting all of these areas of tension that I personally have. And for a lot of us, this is a very common area of tension because of our common postural tendencies. So let's go ahead and switch sides now. So I'm going to bring my left leg straight out now. So I'm stretching my left inner thigh. I'm going to come back to drop to my left forearm to rotate and then swing that leg behind me. So shifting back to the rock back for that inner thigh stretch and then swing the leg behind for that glute stretch. So just alternating between the two. I find that when I do the rock back, I like to tuck my toe of the back foot. But when I do the pigeon, I like to flatten the foot because it's just a little bit more comfortable. We're about halfway through this movement. In about 5 seconds, we'll switch to the 90-90 side camel. So I'm going to place my left leg in front, my right leg to the side. So left leg is an external rotation, right leg is internally rotated. I'm going to start by reaching towards the right side. Right hand's going to come down, and then I'm going to extend in the hips. So reach towards the right side to feel that side body stretch. Bring the hand behind you to extend in the hips to feel a stretch through the internally rotated leg hip flexor, and then alternate between the two. So it might be inhale to reach, exhale to extend. About halfway. And then we'll switch to the other side. Let's go ahead and switch sides. So I'm bringing my right leg in front, left leg is behind. And for me, this is already a more uncomfortable setup because of my common pelvic position, which is really common for a lot of us. So I'm going to reach towards the left side to feel that side body stretch, and then behind me to extend in the hip. And so for a lot of us, the right hip sits more backwards, and the left hip sits more forward. So we tend to be more comfortable internally rotating the right hip and externally rotating in the left hip. And so because of that, there's this kinetic chain reaction through the rest of our body where the thoracic spine is more compressed on the right side, and we tend to be twisted a little bit more to the left. And so this can just cause a little bit of asymmetry through our body and a little bit of like a muscular imbalance. And so this side for me feels really good because it's stretching that right side body that's usually more compressed, and it's stretching that left hip flexor, which also tends to be a little bit tighter as well. So just explore how it feels in your body as well. For the last movement, we're going to move on to the all fours hip shift. So grab onto your yoga block. We're going to come into a tabletop position, and I'm going to start by shifting my weight over to the elevated hip. So in this position, I can lift my right knee off the floor, and I would not have to change my position. If I did not shift over, I would have to completely shift to do so. So shifting my weight over to that left knee that's on the block, and I'm going to move through my pelvic tilt. So inhale to drop my belly to the floor, exhale to round, inhale to drop it down, exhale to round. So when I do this in the rounded position, I feel like more of a stretch in that glute and lower back. And then when I drop the belly down, I tend to feel a little bit more in like the right groin or lower leg, like groin area, but not always. So inhale, drop the belly, exhale to round. Let's go ahead and switch sides. So I'm bringing that block underneath my right knee now, shifting my weight over. So again, I should be able to lift that left knee without changing my position at all. And now I'm going to begin to round and arch in my back. So belly to the floor, exhale to round, inhale to lower. So the all fours hip shift position and hip shifted positions in general, they're something that we really incorporate into our prenatal programming or postpartum programming, because being able to find a hip shift is really important for pelvic stability, for pelvic floor function. And then if you're pregnant, it's also really important to preparing for birth because it creates so much space in the lower mid pelvis where baby is finishing their rotation. It also helps to release tension in the back half of your pelvic floor or the posterior pelvic floor, which helps to influence our sacral position. So how well our sacrum can move during birth and just life in general. So these hip shifted positions are some of my favorite pelvic floor release exercises, and hopefully you like them too. And so that concludes our hip mobility and pelvic floor release workout. This is just one round. If you want to do it again, feel free to move through the movements again, or you can go through them at your own pace. We did 1 minute per side, and so you can do that same effort level for all of the movements again. If you enjoy this workout, be sure to like and subscribe to our channel so you get notified whenever we release new videos. We release 1 to 2 new workout videos every week and 1 to 2 educational videos every week to help support your pregnancy, your birth, and beyond. If you want more workouts like this that are intentionally designed to help improve hip mobility, release tension in your pelvic floor, and just help you move better in your body, check out our online fitness programs. We offer prenatal fitness programming to help keep you strong throughout your pregnancies as you prepare for birth, in addition to our postpartum fitness programmings to help you return to fitness after birth. And we have our Beyond Postpartum program for folks that are looking to continue to work out with us, but are outside of the first 6 months postpartum. Check out all of our fitness programs on our website at MamasteFit.com and use code YouTube10 to get 10% off any of our online offerings. And all of our fitness programs can be bundled with our education courses so that you understand not only how to move your body, but also why it's so important to include childbirth education, birth preparation, and then postpartum prep, like what to expect. So you can check out all of our offerings on our website at MamasteFit.com, and I'll see you next week for another workout.